Okay, so do we lose bones as we get older? And the easy answer is yes. Now, to what degree, it depends on each individual. But more so, as we age, we build bone density in our younger years, and it tends to peak at age about 25. Now, after that point, there's kind of a steady decline in bone density throughout our life. And usually with menopause or postmenopausal years, that can actually be increased from that 0.3 to 0.5% up a little bit as well. So that's something to pay attention for women as well. Oh, that's the one out. Okay, so that right there can increase to 2 to 4%. So in general terms, there that's quite a big hike from just the average 0.3, 0.5 to 2 to 4. Now, what is osteoporosis? So it's a disease of the bones. It's a very simple way to put it. But what ends up happening is the cells in our body that actually build up bone, they stop working as efficiently or as fastly, and the cells that take away any bone that needs to kind of be remodeled or redone just for wear and tear tends to speed up. So what ends up happening is, if you can see from this picture here, is the bones become a little bit more frail and they become a little bit more porous, and it becomes a little more likely that they will have a fracture from like a traumatic event, like a car accident or a fall. Now, one important thing is bone loss is typically pain-free. Because you have anything like bone density loss, it doesn't necessarily mean you have to have pain. Now, things that can happen like fractures, oh, sorry, let me go back to that one. Things that can happen like fractures can be painful, but general bone loss without any sort of consequence or negative thing afterwards is typically pain-free. Now, one thing I also do want to alert you to in these pictures here is if you can see kind of the natural kind of posture that these individuals develop as we get older. Now, with bone density loss, typically what ends up happening is we will end up losing a little bit of our height because the bone density in the front part of our spine becomes a little bit less. And so we end up getting this little kind of more of a forward stoop posture, which isn't always abnormal. It's somewhat normal, but we want to minimize how long we stay in these type of static poor postures. Okay, so here's a couple of risk factors for osteoporosis. So we have the hereditariness. So if you've had a family member who's had osteoporosis or osteopenia, you are at a greater risk. Now, as we talked about earlier too, the older we are, the more likelihood of our bone density to get less. As we talked, the general is that 0.3 to 0.5, and for postmenopausal it can be anywhere as high as 2 to 4. Now, female gender, and a lot of that has to do with just that postmenopausal time frame as being a higher risk. Caucasian or Asian race, that's a big risk factor. Small, thin body. So this is a really common one with risk factors for osteoporosis, and the reason that is because bones get stronger with loads through them. So larger individuals walking around put more load or stress through their bones, so they get stronger. Smaller, thin individuals, unfortunately, and now don't take this as go put on a ton of weight. That's not what I'm saying. But generally speaking, this is something where if you're having a smaller, thinner, frailer kind of build, that's something where bone density may be something to look into. Smoking's a big one. So if you're a smoker currently, if you've been a previous smoker, what that means is smoking actually inhibits blood flow to our bones and other organs as well. When we don't have the blood flow, our bones don't get the necessary nutrients like calcium, like vitamin D. And so we tend to lose bone density a little bit faster for those who are smokers throughout our lifespan. Inactivity. And so inactivity has to do with, again, putting loads through our bones. If we're not moving and putting weight through our bones, then they tend to get a little bit more frail. All right, so previous history of a fracture as an adult. Now, this one you're kind of like, does this automatically put me at greater risk? Not necessarily at a greater risk, but if you have a fracture as an adult and it seems very, what's the best way, curious, like you're like, I don't know necessarily that I should have fractured. I didn't fall that hard, or I wasn't doing anything too crazy. That's something where, hey, this fracture seems a little odd. Let's maybe look into what is our bone density? Because for some things, fractures are normal per se. For some things where you fracture and it shouldn't have fractured, that's something where we look at the bone density. Poor nutrition and general health. So if you're having poor nutrition, generally speaking, you're not getting the nutrients our body needs to stay healthy, and that'll make our body a little bit more frail, a little bit less likely to keep that good, strong bone density. This is a big one at the bottom, especially in this state here. So inadequate intake of calcium and vitamin D. So we are getting into our winter months here, so a little less sun than normal. And the important thing is we want sun, and if we can't get it, we have to intake it somewhere else, either through a supplement or through our food. Now, vitamin D is really important because it helps absorb calcium in our bloodstream. If we're absorbing calcium, then we can build more bone and increase our, or I should say decrease the likelihood of bone risk or bone loss risk. All right, so these are some general facts about osteoporosis that we found in the literature. And so at age 50, so this is how common osteoporosis is. Most frequent, people with low bone mass, so it doesn't necessarily mean osteoporosis, but it can be osteopenia as well, which is for layman's terms, kind of a lesser version of osteoporosis. There's some bone density to loss, but it's not becoming a pathological or disease state yet. So at age 50, those with bone density loss, 1 in 3 women will have a fracture, and then 1 in 5 men will have a fracture. And again, that has to do with the postmenopausal age and changes in hormones afterwards. Now, what increases risk of fracture? Now, for this, obviously, low bone density is going to increase fracture. If the bone isn't strong, it's going to have a higher probability of fracturing or failing on us. Now, the big thing with the state of Wisconsin is a lot of falls are prevented because a lot of them have a result of a fall because of balance. And so balance is a huge thing with those who have bone density loss because we want to limit any falling. Now, if 90% of hip fractures and spine fractures are a result of a fall, if we can limit the cause, the falling, and work on balance, that'll help a lot with risk of fracture. Now, what are some common types of fracture we see with osteoporosis and or falling? Now, these ones are vertebral body fractures. So if you see in this picture here, you see this area right here, this is the vertebral body. Now, this is the area when we bend forward in our body that takes on the load. So anytime you bend forward to pick something off the ground, or you are going to sit down into a chair, this is the part of our back that takes on the load. And so what can happen is too much pressure can increase that likelihood of this body failing a little bit, and it ends up fracturing into here. And you can see kind of how this normal height here ends up into what looks like kind of a little wedge of a pie, I'll call it. And so what ends up happening with this is it can lead to decreased mobility, because this is that painful thing I was talking about, where bone density is not painful. Something like this can be really, really painful. And now the things that they do for treatment for stuff like this is they can do surgeries, they can do something what's called a thoracic or lumbar support brace. But mostly what they do is try to stabilize this area and make it so you don't move as much through there while this is healing. Now, what's the mortality, or what is the death rate with something like this? Now, if you see right here, it's 20% in 5 years. So this is a study done back in 1999. So I'm betting that the mortality is actually probably less at this point, just with development in the medical fields. But in 1999, they were finding that anyone with bone density loss and a compression spine fracture, 20% of those ended up passing away within 5 years after the fracture. So not trying to scare anyone or anything like that, but that is the importance of these fractures and getting on top of our bone health to make sure that everything is optimal with us. Now, this big thing here is something that I use in clinic to kind of hint at bone density loss, and that's a postural deformity. So a lot of the times when you kind of have one day, or you have an accident and then you start leaning really far forward, or you can't bend forward. Something like this might give us kind of a key in to potentially have some imaging or something else to look into. Did we have a fracture, to kind of investigate? All right. Other common ones. Now, you may know somebody who's had this happen, but hip fractures. Now, this picture here is kind of a very common spot to see a hip fracture, and this is right on what's called the neck here. So what ends up happening is, again, there's a higher mortality rate, but if you end up falling and break this, you end up having to go through a hospital stay. But this is a very common site for bone density loss to have a fracture. Now, let's get out of there. What can we do about it? So how do you know if you have bone density loss? This is kind of the big thing with regards to if we're not sure if we're going through bone loss, if we're not sure if what we're experiencing has to do with our bone density at all, these are the tests that we can kind of have done. Now, this here is the gold standard. So this is something that will be able to tell you whether or not you do or do not officially have a diagnosis of osteopenia or osteoporosis. What they do is they'll go through this little scanner and they'll look at the pictures of your skin and they'll deduce how much white signal goes through on the x-ray, and that will tell you how much bone density you have. Now, other ways we can do it are those things we were talking about. So if you've had a loss in height, and the research says about 1.6 inches or more over the last year. So that's something where you're like, okay, if I've lost that much height in that short of time, and losing height over your lifespan is normal. But if you lose that much that quickly, that's something that may key you in on, let's get my bone density checked. This is something I was talking about earlier, fractured bone more easily than expected. Like, for example, if you step down your front step that you've always stepped down for day in, day out, and all of a sudden at one time you fracture your hip just from stepping downward. That's something where we might think about looking into our bone density. This is something I forgot to mention earlier, but drug use is a huge thing with bone density loss, specifically long-term steroids. So if you have an autoimmune disorder or have been taking oral steroids for inflammatory reasons, for joint pains or anything like that, that can increase the risk of having bone density loss. So I always tell my patients here that if you're being prescribed long-term steroids, and by I mean long-term steroids is if you're taking them for a month to 2 months at a time or doing them daily, that's something where we want to have you for sure follow up with your doc to get a bone density screen. And then drop in hormone levels. So if you've had any sort of postmenopausal area or any sort of disorder that adjusts or alters the hormone levels in your blood, that's something that bone density may be impacted. So it could be something that worthwhile to look into. All right, so these are medication options. So some of you may have heard of them, may use them. A lot of what they do is meant to prevent osteoporosis from progressing. So what happens with osteoporosis, it becomes irreversible. So we're not gonna be able to rebuild the bone we've lost. However, we can slow it from progressing. And so what you wanna do is most docs will have their patients on one of these medications or a combination of their, and typically beyond that, they'll have you take some sort of calcium or vitamin D or both supplement, because those are going to be the things that help build the bone back a little bit more once we have osteopenia or osteoporosis. Okay, so these are the big ones for maintaining bone health throughout life. This is kind of what I preach here. Just really, really got to be consistent with diet, exercise, and more specifically, weight-bearing exercises. Now, what does weight-bearing mean? It doesn't mean throwing up a bunch of weight onto a bar, doing a squat, doing a bench press. It literally means just standing on your feet, letting gravity be the main kind of weight pushing down on you. That's more than enough to get bone density stronger. So these are just a couple of snippets from the National Institutes of Health, just what a daily calcium intake recommendation should be. And so let's just kind of go down to the 71-plus-year-old group. So recommended dietary allowances are 1,200 milligrams, male and female. Now, we can get those in a lot of our dairy products, a lot of our green leafy vegetables. Typically, if you're ever curious about what your calcium recommendation or calcium levels are, you can get a blood screen from your primary care. And if it's generally below this number, I would say we can either talk about diet, adding more green leafy vegetables, adding more dairy, safe, low-fat dairy, I should say, and or talking about maybe taking a supplement to add to that dietary requirement. Okay. Now, here's a couple of sources of calcium here. The big ones that I always say is green leafy vegetables are the easy go-to. So you got turnip greens, beans, bok choy, broccoli, okra, kale. All of these are really good sources of calcium. Then you have the common dairy products, almonds, sardines, salmon, herring. All of them are going to be good sources of calcium. Now, let's go on to vitamin D. So biggest one is going to be sunlight. If we get into the sun, obviously in winter it's a little bit harder. If we get into the sun during the summer and the spring and fall, that'll help a lot with our vitamin D. Now, other areas to get it are going to be dairy. So we have cheese, egg, and milk, yogurt. Other common are salmon and then vitamin D orange juice. So you typically need a little bit more in the winter of these type of things because the sun isn't as prevalent. And the recommended daily allowance is 200 IUs, which just stands for international units per day. And so again, that'll be something if you're curious about, you may be able to take a blood panel from your primary care and they'd be able to kind of talk to you about this. All right. So preventing spine fractures. Now these are just some tidbits, that I tell my patients are good kind of starting points. If for some reason exercises are consistent, but you're still worried about it, this is something where we can add changes to your day to make it a little bit easier. But the most important thing is limiting the stress across the front part of here. Now, if you can remember earlier when I said the biggest stressor for the front part or the body of this vertebrae is bending forward or sitting down, those kind of where you start to have your shoulders come in front of your hips when you're doing anything like that, like this position here, that is going to create more pressure on here. So what we really want to focus on is sitting up nice and tall, giving ourselves a seat with good back support so that our muscles back here don't get too tired. And after a couple of minutes of sitting, we end up sitting like this because we're tired. So we really work on avoiding forward bending and then avoiding end range movement from side bend and rotation. So a lot of spine surgeons use these kind of precautions after surgery. They don't want you to bend, lift, or twist. And a lot of what we see with spine fractures is very similar. We don't want to create more load for that low back. All right, so these are a couple of little takeaways just in general life. So how do you prevent pressure on the low back with general kind of things that happen in daily life? So sneezing and coughing. So one of the big things when we sneeze, we kind of lunge forward like that, and that quick movement can create a little bit more pressure on the back than we'd want. So a good thing to do when you're sneezing or coughing is trying to sit as tall as we can while we do it. Now, a good way to kind of help with that is squeezing a pillow when we have to sneeze or cough. Because what that pillow does is it actually blocks us from bending forward a little bit, and it takes the pressure off our back. Now, maintaining a straight spine when putting on our shoes and socks. This is just one where it's really easy to kind of show you. So if you can kind of see me in the bottom of your screen here, when we sit up nice and tall, it's really easy for us to start kind of bending through our back to bend towards our shoes, pull up like this. What we really want to do is sit nice and tall and then bend as one unit. So you can kind of see how my back is straight there versus here, bending forward. When I have that kind of a little bit more of a curvature to my back, it ends up putting more stress on my back. So I don't want that if I have osteoporosis or penia. And in general, I want you bending more of a straight spine overall for just general health. but more so even so for osteopenia or porosis. All right. And this kind of goes in a little bit further. If we have to bend forward when we're standing up, you want to bend from the hips. Make sure that we're not bending from the back. All right. This is a huge one and actually a lot more common than people think. A lot of people can create a risk of a fracture because they're trying to really open a kind of a jammed window. And typically very common in older houses with windows that are a little bit older. But that's something where if we really try to force something open, we can create too much pressure in our back, and that can create a little bit more of a risk of fracture. All right. All right, so physical activity. So let's just get these all out there. So back strengthening exercises have been found to improve or reduce the incidence of vertebral spine fractures. And if you remember the picture from the last slide, where the individual is kind of starting to bend forward a little bit more, typically when that happens, it's because of our back muscles don't have the endurance to hold us upright as long as we need to. And when that happens, the stress on our spine itself increases. And so if we have that increase in stress on the spine, we have that greater risk of developing that osteopenia, osteoporosis. Now, let's talk about how often. So exercising 5 times a week for 2 years, and they walk just for 8 hours per week. So if we do 8 divided by 7, that's a little bit over, or a little bit over an hour a day. Now, for those who are kind of like, I don't have time to walk an hour a day, the big thing is think about how often you're actually walking in your house or around the apartment or to get the mail. It doesn't have to be an hour consecutive, but if you are able to do 5 times a week for 2 years, and by doing 5 times a week, just 8 hours total, you're able to reduce your risk of hip fracture by 55 years. Now, this is a study of postmenopausal women. However, I feel like this is applicable to both men and women because at this point, remember way back in the original slides, is postmenopausal women have a greater risk of bone loss, that 2 to 4%. So if they can reduce their risk by 55%, then men and women who aren't experiencing that high of bone density loss should be able to reduce their risk even more so. All right, so these are just a couple of exercises and other studies that I found that really talk about the benefits of physical activity with exercise. So this first one, they found that just general group exercise and modified yoga improved that kind of kyphotic or that forward stooped posture. Now, again, if we reduce that stooped posture, we reduce that stress on the back, and that'll help reduce any risk of fracture in the back. Now, these are going to be more so the same thing. Postural exercises, taping can all reduce the likelihood of that. Now, these are a couple of tidbits. What can you do? Sorry about that. To help improve your posture. Now, for all of you, we're all sitting at a computer right now watching this, hopefully. Now, when we are at our computer, we want to really make sure that our screen is right in line with our eyes. And how we do this is the top part of our screen should be at eye level right here. Now, if you see on this picture on the left, the screen is a little bit lower than her eyes, so she's having to come down and move her low or her mid back and neck to accommodate for that. Now, some simple exercises that I do a lot in clinic here are to help kind of minimize that from happening. So one of the ones you can kind of see, I'll show you here, is called a towel pull. So if you have a towel in your hand just like this, grab one from here. So we have a little towel right here. So you're gonna have your hands up. What you're gonna do is try and just pull the towel outward. And if you see my shoulders, when I do that, I get a little shoulder blade squeeze. And naturally, if you can show you from the side here, when I do it, I'm able to sit up a little bit taller. And this is something that you can do throughout your day that is really easy anytime you're in a sitting position. It doesn't have to have a towel but it really helps promote us from rounding forward and sitting up nice and tall. Now, other things we can work on to improve posture is helping strengthen our hips and our legs. Now, easiest way to do it, especially with osteoporosis or osteopenia, is going to be with balance exercises. Now, if you see this picture in the bottom left here, we got this lady who is a little bit more of a sway back or curved back position here and a more of a rounded back position here. Both are very common postures that we see in individuals. Both are not perfect postures. Now, with this, what we want to do, let's take this individual here. We can do stuff like single leg balance. So what we work on is her standing on one foot with a computer chair in front of her or a desk in front of her, or table in front of her, and work on her controlling her position of her back, moving in and out, similar to this one, in and out, standing on one foot, just to try and help her get a little bit stronger in her hips so that her back doesn't have to be really arched or it doesn't have to be really rounded. It can be really flat and comfortable in that position. Okay, so here's general exercises and weight-bearing exercises that will be very positive for osteopenia or osteoporosis. Now, the easiest one is walking. Now, I put fast walking in there. You don't have to walk fast. And for balance purposes, I should actually take that out. I should just say walking. Because every time we walk, it allows gravity one little opportunity to push down on us. So it becomes an exercise in which our bones can get stronger through. Now, Tai Chi, I don't know if any of you have ever experienced this, but it is one of the best ways to help regulate breathing with exercise. So if stress is a big thing, if managing time, if exercises are difficult to breathe through, you feel like you're really tired during, Tai Chi is a great resource to allow for all that to be very prosperous. Dancing and ballet is a good one. Hiking, tennis, and obviously weight training are all very positive with regards to what they can do for bone health. All right, so this is kind of what we do here at Capital PT. So one of the things, if I see anyone who thinks they may have bone density loss, the first thing I'll do is I'll evaluate them with a comprehensive evaluation, just kind of looking at them from a range of motion, a strength aspect, and generally a balance aspect. Now, if in that time in my evaluation, I think, yeah, there's something, John Doe really is showing me that, hey, I think they might have bone density loss. What I would then do is refer that patient back to their provider to make sure that they, one, do get diagnosed with it. So for example, I would send them back for a DEXA scan or something like that and get them on any sort of medication or supplement regimen to make sure it doesn't progress. Now, beyond that, what I like to do is provide a lot of education. So kind of like what I did today, I won't do as much each day with the patient, but I'll try to give them a little tidbits on dietary changes, on postural education changes that I can do. And then what I like to do is get going with some therapeutic exercise. Really make sure that if there's one area, like let's say it's a low back fracture versus a hip fracture, there's gonna be different exercises I'd want you doing for either, but not necessarily the same ones for both, if that makes sense. And then this is just a little bit about us here. We don't have to go through too much, but these are kind of our locations in town. We're here as well as 6 other locations. And then these are a couple of sites where you can kind of calculate your fracture risk. So you go on to any of these sites if you have time today or in the future, and they have different surveys, kind of little things that they ask you can fill out, and it actually will spit out your fracture risk based on your bone density. So something to look into. But I believe that's it. So I'll stop that share. And then, does anyone have any questions?
Yeah, I do. I do have a long-term health issue. And so I am on prednisone, just 4 milligrams a day.
Yep.
But I also take a calcium supplement. Does that kind of offset the detrimental effects of the prednisone?
It may. You're already doing the kind of the right things. I would say, do you have anyone monitoring your blood, or not your blood, your bone density? Like, does your primary care monitor it over time?
I've had one bone density just to set a
A baseline kind of thing?
baseline. Yeah.
What I usually would say is unless there's something drastic, like kind of that taking a step off your step and a fracture happening, or something like the loss in height for more than 1.6 inches in a year. Unless something like that happens, I would say just routine monitoring with your primary care. Usually they'll do everything from like maybe once a year to once every 3 to 5 years type thing, depending on where your levels were at that time.
Mm-hmm.
But I would say as long as you're doing the supplements for calcium, maybe vitamin D, especially with winter coming up, I think you'll be doing pretty darn good.
Yeah. Plus, I do a lot of walk. I try to get my 10,000
Good.
steps in every day.
Good.
Yeah.
A lot of things with walking and in regards to exercise that I talk about here is changing up how you strain or stress your muscles and bones. So we can walk forward and backwards all the time. Like that's how we should, right? Now, other things we can do to just strain those bones just a slight bit differently is doing stuff like sidestepping. So going along the kitchen counter and just doing lateral stepping. What it does is just pulls on a different aspect of the bone and makes sure that all aspects of that hip, for example, if we're roughing the hip, is strong and ready to tolerate anything you can put at it.
Good. Thank you.
I have a quick question. So I would say in the last 3 years, I've gotten more into weightlifting, right? Because I'm 40. I turned 40 this year. I've learned a lot about bone loss and just like, muscle and all that kind of stuff. So some of the exercises I do, you do kind of bend at I guess I would say you bend at the hip. Like there's one where you're like, oh, I feel bad trying to, but you're kind of like bent over and you're pulling the weights back.
Yes.
Like this.
Yep.
So I'm always nervous about that one because I actually am bending at the waist. So how do I know if I'm bending too far? Does that make sense?
Yes. So a good thing, and a thing I always can kind of like teach my patients to do this, is if you're curious about where your point is, where you start to bend through your back, what would have you do? And I think the move you're calling is a hip hinge, is what they want to call it.
Yes, a hip hinge.
Yes. So a good way to tell if you're moving through your hips, your low back, and I don't think I have anything here, but I'll show you what Lisa's referring to is a lot of times when we bend, if you can kind of lower down just a smidge, when we bend through our back, we want to make sure we're bending through our hips here. And so when we do any lifting, especially whether it's at a gym or a box in our garage, anything, we want to make sure we bend through our hips and not through our back.
Yeah.
Does that make sense? So a good way to kind of to practice at home, if you're moving a little bit and you're curious whether or not you're moving through your back or your hips, is take something like a broomstick and you put it right on your back here. The broomstick should touch your tailbone here, your mid back here, and if we're really being sticklers, it should touch your head here too. And what you're going to do is you're going to bend forward, and you're only going to bend forward trying to keep all points of contact there. So if you start to feel that broomstick come off your tailbone, you're starting to bend through your back. If you feel it come off your mid back, you're starting to bend through your back. And that's kind of a good way to test how far you can bend without bending through your back. But then also you can use that kind of as I use the word kind of like training wheels to get you better at bending through your hips. And then when you're more comfortable with it, then you take that broomstick away and you see if we can maintain what's called that flat back position, like you did with the dowel or broomstick.
Sounds good.
Yeah.
Thank you.
Of course.
D3 and calcium together, I've heard that helps you to be able to absorb your calcium better. Is that okay?
Yep. Vitamin D is
everybody can take a calcium supplement. I mean, I try to get it in my diet. Obviously, I know there's a lot of days I don't. So I take the calcium just because I know it's kind of helping to replace the stuff that I'm not getting in my diet. But I have heard like the D3 with the calcium helps your body absorb.
Yes, exactly. So the calcium supplement itself, just imagine kind of you take the supplement, it's kind of free floating through our blood. and it doesn't actually get to the bones as well without vitamin D present, because the vitamin D actually adheres to it and allows our bones to absorb the calcium. Without it there, it doesn't have the ability to absorb it as efficiently. We still can get it through other means, but we don't get it efficiently into our bones.
Gotcha. Thank you.
Any other questions?
Don't be shy, you guys. This is your chance. Talk to the professional. Sidestepping. So how would you say is the best way? I think seniors absolutely should sidestep, and they should step backwards. So if they're at home, what's a really safe, like, should they put their hand along a wall?
Yep.
You know what I mean?
I think I use the kitchen counter a little bit more, or a dining room table. The big thing I always say is always try to use something that is not in front of you like this, because if we go to reach for something like this and we hit it too hard, it actually pushes us further back. So I usually say, trying to have something that's flat in front of you, either a line of dining room chairs, a kitchen counter, an island. Now, one thing that I have tried before is for the stepping back part is if you have a really narrow hallway, I usually have the patients kind of push on either side and do something like that. That's okay. And a little bit more safe, but I would say generally try to keep any sidestepping just either at your dining room table or right at the kitchen sink, kind of hands on, going something like that. A kitchen table is a really good one because you can then navigate turning a little bit too. So it adds a little bit of more of a variability to it. But other than that.
Yeah, would the stretchy bands work the same as the towel?
Yeah.
Okay.
Yep. It'd be harder. It'd be harder.
Yeah. Yeah. That's what I use at work. You know, I'll try again, like 3 or 4 times a day to just like take that. Because that is another thing I've noticed with age is like, okay, these shoulders need to get back here.
Yes.
And I worry about my children because they're in virtual school and they're on iPads and phones more. Yep. And I'm hearing that we're seeing it more in younger children. So I'm like,
it's the big cell phone posture, we call it. Everything's right in front of us. Everyone's really tucked, kind of rounded forward, that kind of thing. The big saying that we say around here is just kind of reverse the posture. So if you feel, and most of us naturally do it throughout our day anyways, we'll kind of be sitting there and all of a sudden we'll be like, oh, squeeze those shoulders back. Listen to those kind of sensations, because that is our body telling us like, hey, we need to get into that other position a little bit more. Now that's not telling you, all right, stand at attention all day. We can do this. No, that's saying that what we want is to try and just kind of squeeze it back. We don't have to hold it there. Ideally, perfect world, we could hold it there, but in my years here, I haven't seen anyone do it, so I wouldn't expect anyone to do it.
Well, like you said, just getting up, like we're supposed to get an hour of walking in a day. And I know with COVID and being more isolated and at home, we have to remind ourselves that much more, like to get up and walk. And like set an alarm on your phone if you have to, but like you said, walk across if you're afraid to go outside, that's fine. Find ways to utilize indoors. But I think that's really, really key is that, right? Because sitting, they say is probably the worst. Sitting long-term a lot during the day is like the worst.
The big saying right now is sitting is the new smoking. So anytime I have a patient who has a little bit more sedentary of a life, whether it's because they just enjoy TV or they don't have, or they have pain in their knees, hips, etc. What I usually say is it doesn't have to be a lot, but every 30 minutes you stand up from that position. It doesn't have to be anything more than that, but just standing up out of that position for a little bit every 30 minutes will make all the difference long term.
Even a stand-up desk at home. I have one at work, but I'm like, if you're going to be working from home, or if you know you're going to be home more, and even if you're going to be like using social media, having a standing desk too is maybe helpful. I don't know, but yeah.
Well, I use a standing sitting desk here at work all day because it's the same thing. It just gives me the ability to change position, whether I'm working with a patient, whether I'm doing my documentation. It's something that allows that variability, and that goes inside with osteoporosis and osteopenia. We have to strain our body a little bit differently to make sure it can handle any sort of environment, curb, stair, chair, anything that we can kind of throw at it. Yeah.
Anybody else before we let Tyler go today? So maybe we'll try to get Tyler back in December. What do you guys think? Should we have him come back in December? I thought his presentation was very good today. So Yeah.
Let's
We
do
got
it.
a couple crickets in the background. Chuck's saying yes.
I'm nodding my head. And now I'm
Perfect.
speaking.
I'll get something good together for December then, for sure.
Sounds good. We'll touch base about dates, but thank
Definitely.
you everybody for coming today. Tyler, thank you. It was very good reminders, good information. Take care of yourself, you guys. Any age, remember your mental health.
Yep.
I really feel like one of the best things that has helped me during COVID is to stay physically active. So find something, even if it's 5 minutes a day, start with something small. Reach out to myself or Tyler. All of us are here to help you guys during this time. So, yeah.
Well, thank you guys so much for having me.
Yeah.
Like I said,
Thank
I'm
you.
always here. You guys stop in, have any questions, don't be afraid to ask, okay?
Wonderful. Thank you. Everybody
guys.
have a good rest of your day.